This is a model of the inner ear, specifically the three structures that are used to control your balance. They are shown in the different planes that they work in, so that you can move your head side to side, up and down, back and forth, and still keep your posture and keep clear vision when you're moving your head. Inside these tubes are fluid that moves, and when you move your head around, the fluid moves inside the canal, triggering some nerve cells to tell the brain where you've moved your head. So the movement in those structures gives our brain a sensation of where our head is in space, and then it tells the rest of our body how to make adjustments so that you can maintain your posture whenever you're moving, either your head or your whole body. So this is particularly a design that's set up to help students diagnose something called benign paroxysmal positional vertigo, or BPPV, which is the most common reason why adults get dizzy. So there are calcium deposits that are on two structures that are in this area below the semicircular canals, and on top of those organs are some calcium deposits. A lot of people call them crystals, and they often come loose and start floating around in these canals where they don't belong. So if you can see that it drops, these little crystals are dropping down. This is to represent what happens when those calcium deposits are displaced. But what happens then is that because there's sudden movement in this canal that doesn't belong there, those crystals are supposed to be in a different organ but have come loose and are floating here, the brain gets a sudden sensation that you're moving in that plane, and then tells the brain, hey, we're spinning, and so then the brain thinks that you're really spinning, but it's just because of some faulty stuff going on in these canals. So it's just a nice way to show the students how the crystals move within the canal and what you need to do. There's a treatment that causes them to kind of loop back around and go where they belong. So it helps to show the students how long to do the treatment, how long it takes for these to kind of settle into the canal before you can move them again. It's also nice to use this to show patients if it's going on with them. We can kind of describe what's going on so they have an idea what the problem is and what we're trying to fix.